Hi, my name is Lisa Wisner, Business Performance Advisor with Insperity, where everything we do is aimed at helping your small business be successful so our community can prosper. I believe that small business needs an advisor, and that's my role in this community. And the way I do this is by bringing people and technology to the market to help you run better, grow faster, and make more money. Today, we're going to be talking about how the healthcare reform individual mandate could affect your business. So when the clock strikes midnight on January 1st of 2014, most Americans must have qualifying health insurance coverage or they will face a penalty. So I'm going to be talking about the Affordable Care Act's individual mandate and how it will affect your business's health care costs. So to get things started, I'm just going to point out what the penalties are going to be in 2014. These penalties are going to be collected through the filing of your individual tax return. So if you don't have health insurance coverage right now, be prepared to pay these penalties in your tax return next year. So in 2014, the penalties are going to be $95 per adult and $47.50 per child, and up to $285 for a family, or 1% of their annual income, whichever one is greater. So if, for example, your annual income is 1% of 1% is more than the $95 plus the $47.50 per child, then you're going to be paying that 1% out of your annual income. And then, of course, in 2015, those penalties go up. So from $95, it becomes $325 per adult. From $47, it becomes $162.50 per child, and up to $975 per family per year. And then, of course, 2% of your annual income, whichever one is greater. And in 2016, same thing, another big increase in the penalties, $695 for an adult, $347.50 for a child, and up to $2,085 for a family, or 2.5% of your annual income, whichever one is greater. So let's talk about how this will potentially impact you as a business owner. The individual mandate may cause employees not currently enrolled in your plan, if you do provide health insurance right now, it'll probably cause them to enroll in your plan in 2014. So this will increase your healthcare costs. For example, if you're a company, maybe company ABC, and you have 40 full-time employees, you offer coverage to your employees, you have 75% participation right now, so you have 10 full-time employees who are not currently enrolled, and you have $5,000 contribution per employee, okay? So the healthcare reform impact is A, 10 of those full-time employees who are not currently enrolled, they're going to enroll because of the individual mandate. B, employers' costs of offering coverage will increase because those 10 employees times $5,000, which is your contribution to your employees' health insurance, that's an additional $50,000 that you didn't account for when it comes to your health care costs. So when I visit with owners and they talk about the fact that, it's been delayed, we don't have to worry about it till 2015, it's really a misconception, because when you think about it, you're going to get impacted by your employees going out and understanding that they're going to get better coverage through your business and picking up the coverage and enrolling and increasing your costs. So when the employees go to the exchange, there's going to be four different levels of coverage they can pick from. There's going to be the bronze coverage, the silver, gold, and platinum. When you think about the bronze is 60% of minimum essential benefits costs covered by the plan. The silver is 70% of the minimum essential benefits, gold is 80%, and the platinum is 90%. So just like the awards that are won on the Olympics or wherever, bronze, silver, gold, platinum. Bronze is the lower end of the spectrum, and platinum is the higher end of the spectrum. That's a buy-up if you're interested in that. Now, the penalty for this individual mandate, the penalty is lesser of above amount of the national average for the cost of bronze level coverage in the state exchange. So the penalty has to be less than the cost of the bronze. So if your employees go and look at how much it's going to cost them to buy a bronze health plan, whatever penalty that they're going to get on their taxes, it needs to be less than their bronze coverage. So this is something that the IRS, the government, is going to be figuring out for us, and that way they'll be able to understand who gets what penalties and whether they actually should be penalized. But you'll find that most employees who are working for an employer that is offering health insurance, they're probably just going to opt into picking it up through their employer. So if you have any questions about healthcare reform, if you have any questions about where to get information about the individual mandate, where your employees can go if you don't currently offer health insurance for them, give me a call. My name is Lisa Wisner. You can call me at 361-239-8760, or you can email me, lisa.wisner@insperity.com, or Google me, Lisa Wisner, and you will find me there, and I will look forward to visiting with you and helping you work your way through healthcare reform and the Affordable Care Act. Have a wonderful day.